My name is Brooke Massengale, and I'm going to be performing oral care on my patient today. First things first is I'm going to come into my room. I'm going to wash my hands with warm water and soap for at least 30 seconds, and I am going to dry them and put on a fresh pair of gloves. I am going to follow my agency's policies and procedures, precautions and safety standards for the patient and myself, and good body mechanics. I will come over to my patient, I will introduce myself and check the patient identifiers, make sure he's who he says he is, and then I will let him know that we will be performing oral care today. Pause it. So first things first is I'm going to position the patient in either a side lying or an upright position to prevent aspiration. I am going to bring my bed up to a working height and lower my side rail. I can't get this lowered right now, but I will lower this side rail so I have access to my patient. I'm going to set up everything that I need right with me, and then I'm going to lay my towel across the patient's chest, and I am going to put my pan underneath of his chin. You want your patient, if they can perform their own oral care, you want to allow them to do so. You don't want to take away their independence. So I am going to first, I'm going to get my toothbrush, and I am going to moisten my toothbrush and apply my toothpaste. I'm going to make sure that when I am brushing the patient's teeth, I'm holding the toothbrush at a 45-degree angle. So I'm going to make sure when I'm brushing the patient's teeth, I am going in a circular motion. I am going to go all the way from gum to crown. I will make sure I also brush the patient's tongue and provide suction if needed, if the patient requires it. And then I will make sure that I also get my floss, and I floss for the patient if necessary. I'm going to make sure when I'm flossing, I am wrapping the floss around my middle finger for better control of the floss. I am going to make sure that I'm flossing in between all of the teeth. I'm then going to ask the patient, or I'm going to provide the patient with a rinse, making sure they're rinsing out their mouth and spitting it into the kidney basin. I will then provide the patient with a dilute mouthwash, and then I will, if necessary, I will give them or apply a lip moisturizer, and then after that is all done, I will remove my supplies, and then I will put the bed back to the lowest position, make sure that my bed wheels are still locked, and put back up my side rail, and make sure that my patient is in a comfortable position. Oh, and leave their call light in reach. Okay, my name is Brooke Massengale, and I will be demonstrating how to provide proper denture care for my patient. I am going to come into my room. I'm going to wash my hands for at least 30 seconds with warm water and soap. I will dry my hands and put on a fresh pair of gloves. I will come over to my patient, introduce myself, and check the patient identifiers. I'll make sure that I'm following all of my safety precautions, agency protocols, and good hand hygiene and body mechanics, and then I will let my patient know that I'm going to be helping them with denture care today. So I will be removing the patient's dentures. So these would be in. I would take a gauze pad and kind of just pull these dentures down to where they come out, both top and bottom. And then I will go over to my sink, and I will place a washcloth or a towel in the bottom of the sink, and take a soft bristled toothbrush, and cool water. Warm water could damage the dentures. So we're going to clean our dentures with our cool water and our soft bristled toothbrush, and then we will place them back in the cup and bring them back over to our patient. And then if necessary, we are going to apply an adhesive. We want to make sure that we're checking the patient's mouth for any lesions, redness, anything in the gums. that we may need to tend to. We are going to, if necessary, place our adhesive, and then help our patient put their dentures back in. Again, you want to make sure that if they want to do it, you're not taking away their independence. So you will provide them then with their dentures, and if they do not want to put their dentures in, you're going to store them in a container and make sure that you label it so that way they do not get lost. After I'm all done with my denture care and assisting in putting my patient's dentures back in, I will re-lower the bed, put up my side rail again, make sure that my bed is still locked, and put the patient in a comfortable position and make sure their call light is in reach.